Hello, my name is Max Davie. I'm a community paediatrician and I work in Lambeth. I've got a particular interest in ADHD and I want to talk about the place of medication within managing ADHD because it's an area of great controversy and I don't think it needs to be. If people kind of think about it in the way that I suggest, it doesn't actually necessarily need to be a contentious issue, although there's lots of room for differing opinions. So there's two components of ADHD I want to explain. I'm going to use lines we're going to draw on this screen. So the first one is the brain state of having ADHD. So if you go from here, which is typical, to here, which is kind of at the extreme end, there's various degrees of fizziness of the brain. That is how many impulses there are going on in your brain at any one time, how easy it is for you to concentrate. And actually, I wonder if the movement of ADHD is to do with actually using movement to just sort of keep yourself calm, keep yourself from overflowing and over bubbling. So I think of this almost as a fizzy brain, kind of one that's prone to explosions at times, but they're also one where it's quite hard to see what's going on because there's just too much happening. And there's degrees of that, and we all move around within that spectrum. But of course, the point about having ADHD is that you are towards the higher end of the spectrum. But the key is that the reason why you have ADHD as a condition rather than just as a state is that it's causing you problems. So there's this kind of line I might draw up here, which is how much impairment is being caused by the degree of ADHD the person has. So what determines that degree of impairment? Well, that's where the environment comes in, because the brain state is quite, although there's some variation, where you vary around is quite biological. I mean, about 80% inherited from genetics. There's other factors involved. Prematurity is very important. Other things, perhaps less obviously important. But the actual how impaired you are is really strongly determined by the family environment you're in, and very importantly by the school environment. So schools can do a huge amount to make their environment more conducive by reducing the amount of work that the child has to do at any one time, by reducing distractions, by giving reminders or movement breaks, stuff like that. That's all that sort of really good stuff. And at home, of course, it's all about parenting. It's all about calm, patient, consistent parenting, and that's very easy to say, but it's actually extremely difficult to do for these kids, because as an aside, most children you can get away with being about a 60% good parent, but with ADHD kids you need to be 90% plus all the time, otherwise you're in big trouble. And that's why parenting is an important component here. So, okay, so you've got your school, let's say you've got a child who's about here, and you've got the school and parents working really hard and moving how far the impairment is down to sort of here. That's great. But there's also a curve. If you imagine a particular child in a particular environment and say we were able somehow to change and move a slider of their fizziness, you would start off here at the typical end with no difficulties, because the world is designed for typical people. So you go slowly up, and then after a while you'd start to get a few difficulties, but they would compensate because all children have some kind of compensatory strengths. And then suddenly things would start to go off because they decompensate and start to have big problems. And then they'd level off, because ultimately ADHD is a problem, but you can still walk and talk, and most people can make it to school. So there's a point at which there's quite a steep curve. Now, if you improve the child's management in school or at home, you can alter the curve. You don't have to alter it very, very much in order to make a big difference. If you look at the difference on the vertical axis between those two lines, it's actually quite big. But there are points on this curve where it doesn't make a huge difference. Whatever you do environmentally, it's not going to make a huge difference. So if they've got severe difficulties at this end, the environmental modifications aren't necessarily going to make a massive difference. They may make some. And there's also a point, if you're sort of here and you're still having a lot of difficulties despite everyone really pulling out the stops, then you have to do something else. And that's where medication comes in, because medication is kind of, at its best, one of those sliders. It just moves things along. And if you are here, and you move it along, you move down this lower line, you could see what a difference that could make. It can make a huge difference. And if you're on a severe end, you can move it along. Now, it might be without environmental modification, you're not making a huge difference, but you combine the two, and you can actually make a huge difference. So that's how I see it. That's why I insist that people have intervention in school, and why I insist that parents are properly supported if we're going to also give medication. Now, it may be that doesn't work out quite as we expect, but that's the principle of it. So at its best, medication can be very, very useful, but only in concert with environmental modification, including school intervention, and only usually, I would say, after you've given that stuff a little while to settle in, because it's not an immediate fix, is it? Parenting is not an immediate fix. There's always going to be a lot of time required to settle down and eliminate behaviours you want to eliminate. So you need to give that a little bit of time. So that's the kind of ideal, because sometimes medication works and there's no side effects and everyone's happy. Unfortunately, these are not drugs that are without side effects, and I've got to be honest, the side effects are reasonably frequent. I think that there's some pretty alarmist things about them out on the internet, which I would reject, but you cannot deny that there are frequent side effects, and I'm just going to quickly run through those if people are interested. The first one that you get, generally speaking, is for the first 2 or 3 weeks, maybe 4 weeks. The child or young person is not quite themselves, because they're getting used to having a slightly different brain, and they're getting used to having maybe feeling a little bit off. And so they can be a bit grumpy, a bit irritable. Occasionally this means we have to stop medication, but usually we can push through that because it gets better. The other thing that can happen quite often in the first few weeks is headaches, particularly in the older children, and tummy aches in the younger children. And again, they tend to get better if you persist. Again, occasionally they're usually more a factor in stopping the medication rather than the reason in itself. And then you get on to the one that we really talk about most, which is a loss of appetite. And this is not quite expected, but very, very common. And then what happens is you give the medication in the morning. We tend to give it as a once daily dose because that's just massively easier. You give it in the morning, and actually you'll still have full appetite before you take it. You can have breakfast without any problems. But then, as it wears off in the evening, as it's high in the system during the day, over lunchtime, quite often at school, lunch will be skipped. And then in the evening, as it wears off again, you will tend to get your appetite back. So by giving big breakfast and a slightly later tea, you can often get enough calories to maintain weight gain. And overall, it doesn't look like you have an effect on final height. So sort of linear growth isn't particularly affected, but you can get problems with weight gain. And we do have to sometimes work with dietitians and so forth to try and get enough calories into the kids, or sometimes reduce or stop the medicine, which is a shame because often it's working, but we're not gaining weight, which is tricky. There are some rarer things that can happen, but the one that I tend to mention most, because it kind of worries people, is the effect on the heart. It's not a big effect. I mean, if I'm sitting down, my heart rate might be, I don't know, 70, and my blood pressure will be 120. But if I stand up, those will both go up. Only a little bit, only 75 and 125. That's the kind of effect that the methylphenidate, which is the first line drug, would have. That does not seem to be dangerous for the vast majority of people. So there are some people who have a family history of early problems with the heart that we do an ECG on, but most people we don't, and it seems to be extremely safe. And data from the United States, where of course they give lots of this stuff out, seems to suggest that that's not a problem. So that's the kind of initial medication. That's methylphenidate, which is our first line. That's the one that we tend to start first. There are others, and actually the side effect profile is fairly similar, actually. Probably the second line, atomoxetine, is a little bit less prone to have side effects, but unfortunately it's also a little bit less prone to work in my experience. And then there are some other ones which are pretty don't have time to really go into. But they have various kind of combinations of side effects and effectiveness. The problem is that we don't know what's going to work. We tend to go for methylphenidate first because that has the greatest chance of working, but the side effect profile is troublesome. But the final point I want to make, now that we've put it in context and now that we kind of know some of the risks and the benefits, once you've tried one and it doesn't work, you stop it, that's it. It's like you never had it. It's not something that causes you long-term harm. And now again, there are people on the internet who talk about all sorts of things. I've never seen withdrawal or any of those things or kind of major problems long-term from having had a go at these medications. They go away if you stop them. So I think we should just calm down a bit. I think we can use them. I don't like using them if I don't want, if they're not absolutely necessary, and I certainly don't want to do it if the family aren't keen. I don't think anyone should be pressured to take them. It should be the choice of the family, but I just want things to be, those decisions to be made on an informed basis. So we're not undermining teachers, we're not undermining psychologists. Everyone has a part to play, and medicines is part of that. Thank you very much. There's what